Hi guys, welcome to week 5. So this week we are really focusing on blood collection, but we're also talking about hematology. So it's going to be chapters 4 and it's going to be chapter 5. Now we talked a lot about chapter 4 last week, so I really want to kind of briefly touch over that and hit the main points in chapter 5 that deal with the labs that we're doing this week. So the first thing with blood collection, this week we're learning about doing a butterfly method and actually performing a butterfly method. So last week you got to, sorry, my nose is killing me. We got to do a vacutainer. Now if you did not successfully complete that, don't worry. I'm going to give you a chance this week to do it as well. But you cannot move on to the butterfly until you've completed the vacutainer, okay? But back to butterfly, that is actually going to be the one that we're going to focus with this week. So a butterfly method is really used when you have patients with small veins or very frail veins. So like those in the hand, those in geriatric and elderly patients, and those in children. It's really more commonly used in children because the tubing with it makes it so they can still kind of move around and you can still get your sample. Okay? Children don't like to sit very well to have their blood drawn. It's also more commonly used for the geriatric because their skin and their veins are so frail because they're elderly and they don't have as much elasticity anymore as that they once did. Okay. The equipment that you're going to use for this method is it's a unique design because what it's got is what we like to call it as wings, but those are really plastic pieces that actually help to guide you into the patient's vein. It also has a needle with a safety sheath, and it's got a tubing that comes from the needle all the way down. Now that tubing can hook to either a vacutainer tube like I did last week, or it can actually hook to a syringe. Now the ones that we have here on campus are the ones that hook to vacutainer tubes, so you'll need a hub with this one as well. There are a lot of problems that do arise when we're using a butterfly needle because of the fact when you go to pull out it is so tiny. More problems can happen, and especially when you're drawing in the hand because you're so close to some nerves and the top of the skin, so a lot of nerve endings are there, so it is a little bit more painful for people. So that's something that I want you guys to be aware of heading into the lab class this week, is this one is slightly more painful than the ones that we performed last week. Doing a butterfly method, you have the same order of draw that you do when you're drawing a vacutainer method. So you start with those yellow top tubes or the blood culture bottles. Those always have to be done first. Then you're going to move to the light blue top tubes, which are your anticoagulation studies. Red top tubes, which are generally plain and used as a waste tube between heparin studies and those coagulation studies because you don't want the cross-matching of or cross-contamination of the additives. After red comes the green top tubes, and again, those are really your heparin studies, your chemistry studies, and thyroid panel studies. Lavender is next, and that's your EDTA. What we're really looking at is hematology studies, which we will talk about in a little bit. And then the final tube is the gray top tube. So that's going to be the ones with the for the glucose studies. Okay? Alright, those are the big pieces that I wanted to touch on for your blood collection. Let's talk about Chapter 5. So Chapter 5 is really dealing with hematology. And hematology is the study of visible cellular elements or components in the bloodstream and then your bone marrow. The most common test that you will see completed in a hematology is a CBC, or a complete blood count. Okay? Hematology also studies what is called homeostasis, which is the body's ability to initiate clotting responses to stop bleeding but at the same time preventing blood clots from forming. Okay? When we talk about hematology studies, there are some CLIO wave tests that can be performed in a lab or in a small doctor's office. Those are two that we will focus on this week, and that is your hemoglobin and your hematocrit. So let's start with hemoglobin. talk about your CBCs, or complete blood counts. Again, that's the most common test that you're going to see, and a complete blood count is really made up of looking at white blood cells, red blood cells, your platelet count, your hemoglobin, your hematocrit, your differentials, and your RBC indices. So I want to really focus on your hemoglobin and hematocrit, the two of those parts of a normal CBC. So when we talk about hemoglobin, that really measures the red blood cells by hemolyzing or destroying the red blood cells and measuring those against the released amount of hemoglobin. Generally, the value that you will receive when you complete a hemoglobin is going to read grams per deciliter, or G per DL. And what that means is it's testing the weight, or the grams, of your red blood cells against the liquid or the volume of them, of the red blood cells. When we look at this, every person is going to have a different value, but generally adult males will have a reading anywhere from 13 to 18 grams per deciliter. Women will have one anywhere from 11 to 16. Now you notice there's a drastic difference in men and women, and the reason being every month we have a menstrual cycle as women, so we're losing blood. Okay, that's why ours are going to be less than men. Children are going to have anywhere between 10 to 14 grams per deciliter, and newborns are going to have the most at 16 to 23 grams per deciliter. Okay. This is a capillary finger stick puncture that we'll do, so that means this week you will have, you'll actually end up having, I would probably say, 3 to 4 finger sticks this week, so I'm sorry, make sure your hands are nice and warm and come to class ready. And we're going to use what's called a HemaQ machine to complete kind of our hemoglobin sample. Excuse me, so now we understand how to do a hemoglobin, let's talk about doing a hematocrit. Now hematocrit, you're going to use capillary tubes, and you're actually going to have to collect 2 of them, unfortunately, so this is where those 3 to 4 finger sticks might come in. Again, finger stick. And what a hematocrit is really looking at, it's measuring the percentage of packed red blood cells against the volume of the packed cells, and then doing a total volume measure. So this will be actually a test that we have to centrifuge or spin the blood down, kind of like you saw in your discussion post last week. You saw those videos about centrifuging. We will use a hematocrit centrifuge this week and spin our samples down. You want to take the 2 samples and compare them against each other, and then take an average. So that's how you get your results. And your result for a hematocrit, unlike the hemoglobin, is going to be a percentage number. So men generally have a percentage of anywhere from 42 to 52%. Women have 36 to 48%. Children have 34 to 42%, and this again can increase and change with their age. Infants have anywhere from 32 to 38%, and newborns again most concentrated at 51 to 60%. If you'll notice that most of those percentage numbers, almost 50% of our total blood volume is made up of red blood cells. So that's a big portion of our blood, so it's important to know what our hemoglobin and our hematocrit levels are at. Now, if a patient falls below their recommended hematocrit level, that's considered anemia. So when we do CBCs and we look at to see if you have anemia, we're looking at that hematocrit number. Likewise, if it's too high, that's called polycythemic, or many red blood cells. So that's the abnormal numbers that you will receive. Alright guys, so those are the big topics that I want to talk to you about this week for your chapters and what we're going to be doing in the lab. I will print off all of the worksheets for you again, so you don't have to have those available. Just make sure you pick them up when you do come in. I want to give a reminder that this week your rough draft of your diversity project is due. It is worth 60 points this week, so please make sure that you actually complete it and complete it on time, because you don't want to lose that 10%. And this is one of those assignments that is required to pass this class. So please make sure that excuse me, that you get your rough draft done, because you can't do a final draft until you've done your rough draft. I'm so sorry. I have a tickle. And then the last piece that I want to remind you about is your discussion post for this week. That's going to be due on Wednesday, 2 responses on Saturday. So I look forward to discussion responses, and I look forward to reading some very interesting diversity project rough drafts. Alright guys, I will see you on Thursday. Bye!